As with any CPAP therapy, the cannulaide will only be effective with careful positioning to prevent pressure spots from an appliance under tension or the infant lying on tubing. Vigilant nursing care and developmental positioning considerations are critical to the success of CPAP therapy. To choose the right cannulaide, use your patient's weight as your guide. The size weight recommendations on your prongs will coordinate nicely with your choice of cannulaide sizes. Skin preparation is vital for the best performance of the cannulaide. It needs a clean, dry surface to stick to. Our hydrocolloid is as gentle as it can be, so any oils, ointments, or vernix will compromise its ability to adhere to the baby. I use a saline wipe and a 2x2 gauze to clean the nose, cheeks, and lips. Do this 2 or 3 times to prevent having to replace a cannulaide prematurely. Once the face has been properly prepared, the cannulaide will remain effective for 24 hours or more. First, choose your size cannulaide by your patient's weight. Then, warm the cannulaide in your hands. This will help it stick better when it's put on the infant. Slightly stretch the stellated holes on the cannulaide to allow the soft prongs to poke through easily. Disengage prongs from the CPAP assembly. Now, pop the prongs through the holes on the cannulaide from the non-adhesive side. Place this assembly in the infant's nose, smoothing the mustache portion above the lips and the pedal portion over the nose. Then attach the CPAP assembly to the prongs. This takes only a few seconds. After the cannulaide has accommodated the prongs in the moist, warm CPAP environment, it will allow the prongs to be replaced easily after prong care. For prong care, remove the prongs, inspect the nares with a pen light for signs of redness or irritation. Suction the posterior nasopharynx Q3 to 6, lavaging with a drop or two of saline to keep the nasopharynx clear of secretions. With tiny air passages, any built-up secretions can profoundly reduce the effectiveness of CPAP therapy. If there is a change in the baby, the first thing to check is the airway. Suction the baby. It is normal for the cannulaide to whiten around the edges as it hydrates in the warm, humid environment, but as long as the seal remains, the cannulaide is effective. You will become comfortable inspecting the nares with a pen light with the cannulaide in place. By following these simple steps, we know that you will find the cannulaide to be an excellent and effective adjunct to your CPAP therapy. Fewer complications means that your job's easier and the babies get the best possible care.